Hello and welcome back to Simple Social Sciences. Today we're covering the final part of the psychopathology series. By the end of the session, you should be able to do the following. 1. Outline and evaluate the biological explanation of OCD. 2. Outline and evaluate the biological approach to treating OCD. Let's begin. Students usually get confused between obsessions and compulsions. So what are the differences between the two? Well, an obsession is a cognition. It's a thought that takes place inside the mind, which makes it an internal process. Whereas a compulsion is a behavior. It's something you do, which makes it an external process. Now let's think back to when we learned about the biological explanation. What were the key biological approaches we looked at to explain human behavior? Well, we looked at the genetic and evolutionary explanation, but we also mentioned neural explanations. For OCD, we're going to focus on genetic and neural explanations. According to the biological approach, OCD is biological in nature. It also assumes a person's genes and neural structures can increase their vulnerability to OCD. So the genetic explanation would argue OCD is inherited. The heritability of OCD has been investigated using family studies and comparing concordance rates. Lewis et al. Found that 37% of patients had parents with OCD, and 21% had siblings with OCD, suggesting a genetic link. Patients inherit candidate genes. These are genes which create a vulnerability for OCD. There is no single gene responsible for developing OCD, which makes it polygenic. There are up to 230 genes involved, according to Taylor et al. OCD is also etiologically heterogeneous, which means it has different causes and different groups of genes cause OCD for different people. Neural explanations, on the other hand, focus on neurotransmitters and structures of the brain to explain OCD. Research suggests the genes associated with OCD affect neurotransmitter levels and the structures of the brain. Serotonin is a key neurotransmitter believed to play a role in OCD. Low levels of serotonin mean regular mood-relevant information does not take place. So let's apply our knowledge of the biological explanation so far. Joey suffers from OCD. His grandfather and uncle also suffered from OCD to the extent his uncle had brain surgery to relieve symptoms. What might a psychologist tell Joey about the likely role of genetic vulnerability in causing his OCD? I will let you pause this episode to have a go at trying to answer this yourself. When you're ready, press play to hear suggestions for your answer. So some of the things a psychologist might tell Joey is that OCD seems to run in his family, which means it's very likely he inherited the vulnerability to OCD. There is no single gene responsible for OCD, making it polygenic, and there are a range of candidate genes for OCD, including those related to regulating serotonin levels. OCD has different causes, which could explain the severity of his uncle's case, but maybe why his grandfather or Joey himself may not experience OCD to that level. So what are some of the strengths and weaknesses of the approach? Well, a strength is a real-life application. For example, drug therapies such as SSRI were developed as a result of the biological explanation of OCD. This is a strength because such therapy treats people and improves the quality of their life in the real world, therefore increasing the ecological validity. Furthermore, twin studies support the genetic explanation of OCD. As such, studies support the idea that the greater the genetic similarity, the more likely it is both individuals develop OCD, which essentially means they have high concordance rates. This supports the biological explanation for depression, increasing its validity. However, a weakness is biological reductionism. This theory ignores other important factors such as the role of schemas or faulty information processing, which equally play a part in OCD. This is a weakness as reductionist explanations only offer a partial explanation, therefore reducing its credibility. Additionally, twin studies do not always suggest a genetic link. Identical twins share more than just their DNA. They're also more likely to experience greater similarity of the environment because they would be the same sex, most likely go to the same school, and so on. This would explain why more MZ twins share OCD rather than DZ, therefore this reduces the validity of the approach to explain depression. The biological approach uses drug therapy to treat OCD. This therapy assumes there is a chemical imbalance in the brain. This can be corrected through drugs which typically increase or decrease levels of neurotransmitters in the brain. For this topic, we need to learn about antidepressant and anti-anxiety drugs because we need to know about more than one type of drug to treat OCD. SSRIs work by inhibiting reuptake of serotonin. And remember, serotonin is the key neurotransmitter involved in OCD. So in reuptake, excess neurotransmitters are reabsorbed into the presynaptic neuron that release them, and this is very normal. So whenever there's excess neurotransmitters, it will be reabsorbed into the presynaptic neuron. In patients with OCD, there seems to be an issue with regulating serotonin levels. So what SSRIs will do is block the reabsorption, causing levels of serotonin in the synaptic cleft to increase. As there is more serotonin in the synaptic cleft, it makes it more likely serotonin will reach the postsynaptic neuron, which passes on the chemical messages regulating mood and improving symptoms of OCD. Benzodiazepines are anti-anxiety drugs. These work by increasing the activity of GABA, which is a neurotransmitter reducing neural excitability linked to anxiety. Benzodiazepines bind to GABA receptors, which inhibits brain activity. By inhibiting the activity of neurons involved with anxiety and arousal, the drugs are able to reduce the anxiety experienced with OCD. Because remember, OCD is an anxiety disorder. So what are the strengths and weaknesses of the approach? Well, a strength is the research support for drug therapies. For example, research comparing SSRIs and placebos found SSRIs to be significantly more effective than placebos, making it a useful treatment for most patients. Furthermore, drug therapy is cost-effective and requires little commitment. This is because it doesn't involve multiple sessions with a highly skilled therapist. Patients can just take their medication on their own. However, a weakness is that drug trials are unreliable. This is because often research into drug trials are conducted by drug companies themselves, which may mean results are biased as they do not publish research showing drugs to be ineffective. Therefore, such data may not be trustworthy, and so drugs may not be a useful treatment. Furthermore, drugs have side effects ranging from indigestion to disruption with heart rhythms, and even death in some severe cases. As a result, people stop taking their medication due to the discomfort, which reduces effectiveness of the treatment. Okay, that's the end of the session and the end of the psychopathology series as a whole. You should now be able to outline and evaluate the biological approach to explaining and treating OCD. Don't forget to revisit all the topics as part of your revision and comment one thing below that you learned about studying psychopathology as a whole.